her braces weren't off, I don't know, 6 months, and she was already crowding. I took him back to the orthodontist, and he said, well, we'll do it now Invisalign. Did Invisalign, and they're crowded again. And I'm saying, my goodness, I mean, here we are straightening teeth, and they're crowding again. And I've had a number of experiences with orthodontists, and they spoke a different language than general dentistry, and it really bugged me that I couldn't really understand what they were saying. So finally, I just said, I'm going to go back to school and learn ortho. I don't like what I'm getting back as results. I don't understand why Sydney's breaking down as fast as she was fixed, so to speak. So I went back to school and learned traditional ortho. It was a 2-year program. I'd go Friday, Saturday, Sunday, Monday, and I started doing traditional ortho. And a mentor of mine says to me one day, he was a mentor in gold dentistry, where we do gold inlays and stuff. He was out in Seattle, Washington. He said, you need to look at the power of podcast, John Mew on YouTube. So I look at what John Mew's saying, and he's saying, hey, when we're putting people in headgear and holding their jaws, upper jaw back so that their lower jaw can catch up, and that's how we're fixing, buck teeth, and, extracting teeth is totally wrong. I was like, wait, if this guy's right, then I've got, 4 kids right now in headgear, and I'm mistreating them. I couldn't sleep.
Welcome, everyone, to the Hol-Truth Podcast with Jon Levine, and we are here with Dr. Victor Avis. He is a general dentist who refers to his Staten Island, New York practice as the Avis Alternative. The Avis Alternative deals with the multiple specialties of dentistry, including orthodontics and orthotropics. He is dedicated to making a difference in the health of his patients and recognizes that oral health is connected to overall health, and that dental disease is most often a sign and symptom of an underlying lifestyle issue. Dr. Avis strives to positively affect the patient's sleep, nutrition, exercise, and stress. And here he is, Dr. Avis. Nice to finally meet you.
Nice to meet you, John.
Thank you for coming on the show.
I'm glad to be here, and it should be a lot of fun.
And for true transparency, my kids go to see you in Staten Island.
Yes.
When my wife found out about orthotropics and that there was a different way of doing things other than the traditional dentistry, she jumped all over it, being a great mom, and she said, I am going to see Dr. Victor Avis in Staten Island. I'm like, where are you going? She's like, it's orthotropics and orthodontics. And I'm like, oh, babe, what are you doing now? Which is great. So you treat my kids, and I have to also tell you that last night I was reading a book with my daughter, and she said, Daddy, I have to pause because I need 10 minutes to do my exercises. I said, sweetheart, it's getting late. I got to read you a book. How long are the exercises going to take? And she's like, 10 minutes. She's like, who is it Jeannie? Jeannie. She's like, I promised Jeannie I would do it 3 times a day. So I actually made her skip the exercises last night because it was running late, and I did want to read to her, so forgive me. But let's get into it. So tell me your background. How did you get into the Avis Alternative? Give me a background of...
Sure. Well, first of all, I do now see my role in dentistry as dentistry is my entry point. And so people come to me and they believe they're coming to me to fix their teeth. And I know that their oral health is just telling me a story about their overall state of well-being. And as I build relationships and trust with people, I really see my role as nudging people in the right direction relative to their overall well-being. And as I look for the underlying cause of whatever their dental challenge is, it typically leads me to things that seem to be outside the realm of general dentistry. And I've been a student like yourself. I've just been a student of health and wellness and dentistry. I've had a voracious appetite since I started this career, and I can't learn fast enough, and I'm humbled each day by what I don't know.
And was it your dad and your grandfather they were also in dentistry?
Yeah, my grandfather was one of 11 kids, the only one that went on to college. He was in the Bronx. He heard there was opportunity on Staten Island. He took the ferry across, opened his practice on the same block that it is today in 1922. So we're coming up on 100 years.
The same. That's where your office is.
Yep, in the same exact block. I mean, it might be 300 feet from. He was above a storefront. And
Oh, that's so cool.
Yeah, and we have some people that have been patients for, 80 years, over 80 years, their whole lives. So it's pretty neat.
That is really cool.
Yeah, so I'm
Good for you.
I'm proud of that heritage. So thanks for asking.
Yeah. So how did you get to the Avis alternative? Meaning, like, you have your dentists, you have people who do orthodontics, and they do it the traditional way. They do it the way they're taught. How did you get to your way of thinking? Like, because most people don't look at it like, okay, you have a root canal. I have to take care of the root canal. But you're looking at this very differently. You look at it like I look at a lot of things. But where did that come from?
I was really, our kids really inspire us in many ways. So when my oldest daughter needed orthodontics because of crowded teeth, I was not doing ortho at the time. And so Sydney's now 26. And so I thought that there was a orthodontist in Madison Avenue. So your wife's traveling from here to Staten Island. I traveled from Staten Island to Madison Avenue. What a pain in the neck. Every time I saw the orthodontist, it was, I think, $54 to park my car. I think I paid more in car parking than I did in ortho. But, I thought, I'm going to take her to the best. And her braces weren't off, 6 months, and she was already crowding. And took him back to the orthodontist, and he said, well, we'll do it now Invisalign. Did Invisalign, and they're crowded again. And I'm saying, my goodness, I mean, here we are straightening teeth, and they're crowding again. And I've had a number of experiences with orthodontists, and they spoke a different language than general dentistry, and it really bugged me that I couldn't really understand what they were saying. So finally, I just said, I'm going to go back to school and learn ortho. I don't like what I'm getting back as results. I don't understand why Sydney's breaking down as fast as she was fixed, so to speak. So I went back to school and learned traditional ortho. It was a 2-year program. I'd go Friday, Saturday, Sunday, Monday, and I started doing traditional ortho. And a mentor of mine says to me one day, he was a mentor in gold dentistry, where we do gold inlays and stuff. He was out in Seattle, Washington. He said, you need to look at the power of podcasts. John Mew on YouTube. So I look at what John Mew's saying, and he's saying, hey, when we're putting people in headgear and holding their upper jaw back so that their lower jaw can catch up, and that's how we're fixing, buck teeth, and, extracting teeth is totally wrong. I was like, wait, if this guy's right, then I've got, 4 kids right now in headgear, and I'm mistreating them. I couldn't sleep. And so, like you talked about your wife, hey, once she gets something in her head, well, same thing. I'm bird of the same feathers, so to speak. And so about a week later, I called John Mew, found out he was still teaching. He was 85 at the time.
He's from England, right?
England. I said to my wife and staff, I said, you guys, I know you're going to think I'm nuts, but I got to go to England. They don't think I'm nuts anymore. They know I'm nuts. And so
You're nuts in a good way.
I was immediately on a plane to England. I took my lab tech, who's a really lifelong learner and a real bright guy and a skeptic, Paul Federico. We flew out to England, and we spent a week there with John and his son Michael. And what I saw and what I heard and what I learned was the right thing. And I continued to learn with them over the next year. And that was Orthotropics. He was a developer of Orthotropics. And
He invented it?
I guess developed it. I hate to say invented it, but he certainly developed appliances and the method and the approach. And the whole idea is, if orthodontics is straight teeth, that's what in Latin those words mean. Ortho is straight, and dontics, teeth.
Okay.
Orthotropics, tropism is growth, like a plant grows to the light. That's phototropism. So orthotropics is straight growth. So that was the term he coined.
Oh,
and
interesting.
So orthotropics really has little to do with teeth. We're trying to basically help young kids develop optimal growth by creating proper oral posture. And with that, we'll create so much room for their teeth, and teeth really know where to go if they have enough room and space, and the tongue and the lips are working properly, that they'll just figure themselves out. We don't have to worry about the teeth. Let's just get the growth right. And the growth is related to airway, and that takes me, in an interesting direction as well.
We can go in a lot of different directions. So, with a regular traditional orthodontic, what are you doing specifically that is different? Like, if I were to go into an office, an orthodontics office, compared to your office, like, just what exactly are you doing differently? Like, are you using different devices?
Well, I think, John, is a great question. Let's start off with, I think the questions I'm asking at the initial visit are very different. So I'm asking, is your son or daughter having any challenges with focus at school? Do you hear them snoring? They have issues with bedwetting? Do they have any allergies that make it difficult for them to breathe through their nose, whether it be an allergy to a dog or allergy to mold or grass? And so I'm looking at what their overall health and their ability to focus is, because we now know that improper sleep with a child, even if you have one episode of apnea or hypopnea, which is either stopping breathing for 10 seconds or more or just having reduced inflow of oxygen, just one of those per hour for a child is considered sleep apnea, because the children's brains are growing and developing so quickly, and you only have that certain period of time to create these neuroconnections. And if you've got poor oxygenation going on day and night, it's going to change your ability to deal with life. And so that's what I'm trying to figure out. If I see darkness under their eyes, I'm concerned mostly about the kids with respect to their airway. That's kind of where it starts different. I mean, my first interest isn't how crowded your teeth are. If the teeth are crowded, I could spot it from here. If a lower kid should have space between all the teeth. If they don't have space between all the teeth, they're crowded. But, I want to know, is there something that the parent may observe about their child that may not be quite right?
That's interesting. And I realized that I am a mouth breather. Thanks to you.
Yeah.
I am.
I learned it as well, but I only learned it about 8 years ago, but yeah.
I realized because my wife came home and she's like, I think you're a mouth breather. just like our son is a mouth breather. And I am. I don't know how that happened, but I realized sometimes I'm actually not breathing. And as you were talking to me, I'm trying to tell myself, John, put your tongue behind the top of your teeth and breathe in through your nose, and stop opening your mouth and breathing, because I tend to open my mouth and just breathe through my mouth, which is not correct, right?
Right. And it's a relatively recently a kind of learned adaptive behavior. So you don't have to go back but about 450 years to look at skulls. And so there's some really great anthropologists, and now there's a really neat guy out of Chicago, Kevin Boyd, who's an anthropologist and pediatric dentist. So he went back to get his PhD in anthropology. But,
oh, wow.
But they've been looking at skulls now of, just not that far back. And people had plenty of room for all 32 teeth, and their jaws were more forward. And so what's happened with the Industrial Revolution and the Cultural Revolution, we've had a tremendous change in 400 years in our faces.
So 450 years ago, you can get a skull, and they have perfect teeth?
They've got 32 teeth beautifully aligned.
And the jaw is straight.
Palates.
Their chin is not below the top front.
Yeah, things are more forward. If you go back to like when you're a kid and you studied like Cro-Magnon man and Australopithecus, what would strike you is that their jaws look more like ape, right? They were very more forward and full. And now, of course, we're really flat. And in between, there's been this evolutionary change. But what I'm pointing out in the last 450 years, that's far too short a time for evolution to select people with flat, longer faces. What's happened is because of air quality from the Industrial Revolution, we got clogged up. We had to start breathing through our mouth. We start eating processed foods, softer foods, so we don't have to use our jaw muscles to tear apart.
We're not chewing.
We're not chewing.
We're not using our teeth.
Exactly. So we're developing different muscular structure. We're hanging our mouths open because we can't breathe through our nose.
Right.
And so with that, our faces have changed. We have an epidemic of sleep apnea.
But
How many
the
people do you
face-
know have sleep apnea? Do you know anybody?
Some people, a lot of people.
Yeah, I mean, it's usually you just either if the wife doesn't have it, the husband has it, and
Yeah.
if not, somebody at work's wearing a CPAP machine,
Yeah.
And
Hey, it brought to light a lot of things. I don't breathe through my nose too well. Yeah, it makes sense. A lot of the chemicals and the toxins and and I eat pretty clean. In fact, you know what? I use the lip seal tape, and I know you. Do you use it
I
at night too?
do as well. I just use 1-inch cloth tape, and I tape every night, as does all
it-
three of my children
Is this
and
the
my
one-
wife. Yeah,
is
that's it.
This is it.
Yeah.
Okay, so I have two. I have the lip seal, and then I have the cloth tape. And I gotta be honest with you. So I actually grind my teeth, and I really so I have a mouth guard. So I put the mouth guard in, and then I put the lip seal or the 1-inch thick tape, and I still open my mouth. There's times I wake up and I'm like, the tape is off, which means I guess obviously I'm not breathing through my nose.
Right.
How do I fix that? Can I just practice throughout the day of just reminding myself to breathe through my nose? Like my daughter, it's the exercises, right? So I guess
Right.
my point is we're getting back to these exercises that my daughter is doing, and I don't know specifically. I know some of them. Can older people do these exercises to improve their sleep?
Yeah, so you're referring to a field called myofunctional therapy that's been around for a long time, and basically it's the concepts are we want to retrain connections between the lips and the tongue so that their lips are together, the tongue's up on the roof of the mouth, and people are breathing through their nose. When you breathe through the nose, a lot of health benefits. You filter the air, you humidify it, you warm it, and you mix it with something called nitric oxide, which is this really important, not nitrous oxide, but nitric oxide, which is basically nutrition for your blood vessel walls. So it's significant with cardiovascular health, and it's significant in upregulating your immune system. When you breathe through the mouth, none of those things are happening. And so you're irritating the back of your throat, which is your oral pharynx. That gets inflamed and your airway shuts down a little bit more, which makes breathing even more difficult. So that nasal breathing is a big deal. Oddly enough, when you're born, you're called an obligate nasal breather. You have to breathe through your nose. So breathing through the mouth is a learned behavior most of the time for survival because we're clogged up here.
I didn't even think about that.
Yeah.
That's right. When you're a newborn, you can't breathe through your mouth.
No, until the epiglottis drops down. So there's a physiologic and anatomic change that happens early on. But until that happens, you have to breathe through your nose. So, again, women used to breastfeed for 2 years, 3 years. Now, since Cultural Revolution, women going to the workplace, more bottles are introduced. The minute you're drinking through a bottle, it's very different than suckling through a nipple, and so you're using your tongue and your lips a totally different way. You're breathing through your mouth. So we've changed because of not only the environment and the foods, but even the cultural change of less breastfeeding, women going back to work. So all those things have contributed. So yes, you can retrain it with myofunctional therapy, but a lot of times the playing field is too small. I mean, you're an athlete, so you put 22 people out on the field to play soccer. But I mean, if all of a sudden you put 22 people and you're playing soccer in the gym, it's a different game because you don't have enough room, and you're going to try to make it look like soccer out on the field, but it's not going to look like soccer out on the field. It's like arena football doesn't look like NFL football. It's a different field. So if your palate's too narrow, if you've had 4 bicuspids extracted, and you're trying to breathe through your nose, and or if you have a deviated septum, which goes along with a narrow palate, you're pretty darn challenged, even with myofunctional therapy, to retrain it because it's tough to breathe with your lips together.
So what are the exercises that you teach kids? So when you have kids that come in and they have these issues, maybe they're breathing through their mouth and they're crowded and they don't have enough room, or what are the exercises specifically? So
Sure. Well, first of all, there's education. So just take your kids and my kids. They don't know they're supposed to breathe through the nose. So just taking a young person who's so malleable and open and saying, hey, Nessa, you should have your lips together and be breathing through your nose. So unless you're speaking, your lips are together. When you're chewing, your lips are together. When you're at rest and somebody's talking to you, your lips are together. So, well, okay, I'll do that. Somebody with a white coat, or somebody that I respect, or somebody that's kind is giving me that instruction. That's sometimes, just knowing that that's the right thing to do could be helpful. And then you're doing things like, we'll put a little stoma adhesive. It's a little adhesive that'll sit behind the two front teeth, kind of where you'd burn yourself if you had hot soup or hot piece of pizza.
Right behind the front teeth.
Yeah, and we call it
on the gum.
On the gum, we call it the spot.
What is it? Yeah, because I've seen the spots. There, my daughter's.
Yeah.
What are those made of? What are
It's a product that'll dissolve. I don't remember exactly what it's made of, but the idea is if I put a pebble in your shoe, you're going to play your toes with it. If I put that stoma adhesive, now the tip knows where to go. So we're starting to train a connection between your brain, your tongue, which is a muscle,
right,
and a spot where the tip should rest. And teaching then swallowing. That tip should stay there. Then you bring your teeth together, and the back of the tongue will then make a seal on the roof of the mouth. See, most kids are learning to swallow involving their lips, so it looks... Is there a camera on here?
Yeah.
So if they swallow, you'll see a lot of movement here. And that's because I'm pushing my tongue against my teeth, and I'm using my lips to make a seal. But if I put my tongue in the right spot, I don't need to involve my lips at all, because I'm just pushing my tongue up on the spot. Okay. And then the back 2/3 are going against the hard palate, and it's pushing the food backwards. And so teaching kids how to swallow properly, where the tongue should be at rest. Now recognize that tongue is some powerful muscle. Not only is it attached to 8 different bones, but if it's sitting up on the roof of the mouth, it's going to create this big wide arch form. There will not be crowded teeth. If that tongue's up on the roof of the mouth, you'll have room for all the teeth in the world. And not only that, it's going to keep the maxilla up and forward.
I guess if we go back 450 years, we know that, right?
Yeah, people
because they were
had
doing
their lips together and they had their tongue up. They wouldn't have these huge palates. They had palates which were like, if you measured from first molar to first molar, they were in the 50s to 60. Now most of the people I'll measure are somewhere between 28 and 33, with like half the width.
That's unbelievable.
It's unbelievable. In 450 years, I mean, that's crazy.
450 years. So perfect teeth. Hey, Ming, is there any way to get some pictures up? And on YouTube, when it's on YouTube, I'll actually...
Gotcha.
But pictures up of the actual, 450-year-old, skeletons. And what would we look up? Orthotropics...
I don't know the answer. I mean, we could search here for a while. I mean, certainly Kevin Boyd, B-O-Y-D, might be posting some stuff. He's the anthropology pediatric dentist that's been doing some neat stuff with Mariana Evans out of University of Pennsylvania. They're both really engaged with that. But as we're waiting for that, I mean, I think the importance with that postural piece is that it's not even as much what you're doing in function. It's just when at rest, that your lips should be together, your teeth touching lightly, and your tongue up on the roof of the mouth. That will create this forward development of the upper and lower jaws and create plenty of space for airway.
Am I doing it now?
Yeah.
So my lips need to be together.
Mm-hmm.
Tongue at the top.
The tip. If you just have that tip on that spot behind the 2 front teeth, okay. The back 2/3 will start to migrate up onto the roof of the mouth, and then breathe. It looks like you're having a hard time breathing.
You know what? I don't breathe too well through my nose.
Well, you have a deviated septum.
I do. You can see this indent.
Yeah. So
thanks for pointing that out.
You're a handsome guy.
Doesn't help that you have a Jewish nose too, right?
That's right.
2 Jewish noses on this podcast.
I'm right there with you. So
those do not help with the airway breathing.
So Steve Park is an ENT out of Montefiore in the Bronx, and really bright guy. He wrote a book called Sleep Interrupted. But Steve and I have developed a nice relationship, and he says that if you don't have your palate wide by age 11, you're going to have a deviated septum. Because you see, the roof of the mouth is the floor of the nose. So if the roof of the mouth is compressed, narrow and high,
Right.
there's less room for the structures of the nose, so you're going to get a deviation. Now that you got a deviation, you can't breathe effectively through your nose. So
Is it too late for me?
it's not surgically, oddly enough. And surgical intervention is something that's probably done far too little, crazy enough. Because when you look at the number of people that are going to CPAP, so there's a small segment of the population yet that has diagnosed sleep apnea. A much greater segment has it. I forget the millions that have it that aren't even diagnosed.
And that's only 10 seconds?
10 seconds.
So
stop
10
breathing for
seconds
10
if I
seconds.
stop, and that's considered sleep apnea?
If it happens 5 times in an hour for an adult. So 5 interruptions of
Right.
breathing for 10 seconds or more is
But that
sleep
is a lot.
apnea.
That's actually a lot of time.
It is a lot of time.
I don't, 10 seconds of not breathing.
So I have sleep apnea. I didn't know that I had
Oh, you do?
sleep
You
apnea.
you have it right now?
Yeah. And so when I was a kid, things are personal, right? When I was a kid, I loved school. I'd fall asleep. In dental school, they would take pictures of me and they'd tease me because I'd sit in the front row and fall fast asleep. I mean, I was so anxious to learn. I didn't know I had sleep apnea. It was undiagnosed. When I was a young kid, my sisters used to tease me and they'd say, "Vic, you snore so loud, you keep the whole house up." It was just something we laughed about, right?
Right.
And here I was. It wasn't until I'm 50 years of age that I get diagnosed. Because I start learning, I said, I better get sleep tested. And sure enough, I have sleep apnea.
So you went to a sleep
a
clinic?
polysomnogram at a sleep clinic.
And
yeah.
you literally had to fall asleep, obviously.
Yeah.
And then
Yeah. So here I'm one of those people that. So we're built to adapt.
I got
and
to tell you
compensate.
something though. I went and did a sleep clinic study.
Yeah.
For myself for the same reasons.
Yeah. Couldn't sleep.
But I couldn't sleep. I was up all damn night.
And it's one of the legit issues with it. It's not the be-all and end-all diagnostic tool. It's one, but like with you, it could be really misleading. So you might be better off with a home sleep study or a good endoscopy done by a sleep-oriented ENT like Steve Park, who can kind of look and just see as you laying back what the soft tissue does and how much it closes. So there's lots of different ways to get the same information.
But to your point, so when I learned about this, when my wife came back and said, okay, I went to Dr. Avis and she said all these different things and I researched it because when I get something in my head, I research it and I want to know about it. This is personal too. I'll throw myself right under the bus. When I get good sleep and I actually, for whatever reason, like sometimes if I've really eaten well and exercised and I fall asleep well. I could just tell I wake up and I've breathed through my nose. My eyes look good. My face looks good. I look clear. But there are nights where I wake up and my mouth is open. And then I wake up and I look in the mirror and I have indents under my eyes. And it's without fail. You can see it. I mean, it's every time. And now I pay attention to it. And with the tape, it definitely helps. There's certain nights where like literally the tape is broken because I'm trying to breathe through my mouth so much that I'm breaking the tape. But if I get a good night's sleep, you could see it in my face. You could see my face looks better.
No doubt about it.
It's like no question.
One of my office staff, Dee, used to get a sore throat. But when I say sore throat, I mean her tonsils were so huge, and Dee was in her 50s at the time. When I said, "Hey, Dee, why don't we use tape?" And she went, I'd say, 2 years without getting a sore throat after getting huge sore throats for every month for about a week. So because all of a sudden she wasn't breathing through her mouth and she wasn't irritating her back of her oral pharynx. So, these are anecdotal, but it's significant. My mouth, if I forget to tape, which is rare, I'm so dry in the morning. Whereas
really?
if I tape, my mouth is much more hydrated because when you're breathing through your mouth, you're blowing off so much fluid.
Yeah.
So you're really dry. And by the way, when you dry your mouth out, you're changing the environment. You're creating a much more acidic environment, and you're changing the bacterial components, so you're increasing your susceptibility to tooth decay. So,
wow.
Big deal. So I've got a tongue tie and I breathe through my mouth. Well, if you got a tongue tie, you can't clear the food from around your second molars because you can't flop it over there.
Right.
And if you're breathing through your mouth is dry, and all of a sudden you're not washing away the bacteria, you're not neutralizing the pH, and so your susceptibility to tooth decay goes sky high. So when somebody comes in and they've got tooth decay, yeah, am I starting to think, well, I wonder if they're a mouth breather, I wonder if they've got a tongue tie, I wonder if they've got an airway issue. You know, they just want me to fill the filling, you know. Well, I will fill the filling, but want to understand a little bit better about their nutrition, their sleep, their airway, and that's how these things happen.
What you're doing is awesome. I love it. I love this way of thinking, and I've tested it. My daughter's on it. My son's on it. I'm on it. I notice it, and I don't just believe everything I hear. I need to know what's going on. I got to read about it, but I also have to. I test it with myself. So, and that's kind of with the tape and my eyes and my nose, and it works. It may be too late for old bastards like us, unless we have to get surgery.
I want to just address that, because the surgery thing seems so far off, but it shouldn't be far off. Because what I was going to say is there are people that have to, retire from the MTA, the transit authority, or people that can no longer be airline pilots, or people that are having car accidents because they're sleep deprived. So surgery could save your career, could make you feel better every day. And so what are they doing in surgery is what we're doing with orthotropics. You're taking your maxilla, you're moving it forward, and you're taking the mandible and moving it forward and massively opening your airway and making it possible, oftentimes fixing the turbinates, the deviated septum. And my God, you can just change somebody's life like that.
How invasive is this surgery? Like, how is it? Is it a big surgery?
Well, it's something we're really thinking about for my daughter Sydney. So I've been looking into it quite a bit. So,
oh wow, okay.
So it's a surgery that
and she's 27.
She's 26.
She's 26.
26. Okay. I was speaking with a colleague, Dr. Sandra Kahn, who wrote the book Jaws recently. She did the surgery with her 15-year-old daughter had the surgery. So when you're taking your own kids and you're putting them in surgical, it's because you understand how critical airway and down-regulating this fight-and-flight sympathetic system and enabling people to be more calm and relaxed has on a lifetime. And so it's about, it could be anywhere. That the fellow that she's recommending in Spain has had her daughter out of the hospital in one day. I think Razum Overhead in St. Louis, who's really one of the tops with Tom Wofford in Dallas in our country. You might be in the hospital 3 or 4 days, and then it's a recovery of months, but you're getting better every week.
Yeah, sure.
But the changes are significant. In fact, Kevin Boyd's daughter, she also had the maxillomandibular, because we've missed the boat with our kids. I didn't know about this for my children.
Yeah.
So like with your kids, I might have a shot with orthotropics to do surgery without doing surgery. That's what orthotropics is. We're getting the maxilla forward and then the mandible forward and wide.
Well, that's the key, and that's the beauty of this. So that's what this podcast is going to bring to the table. Yes, I can get surgery, and you know what? I'd probably consider it, quite frankly. I probably would, because I can't breathe too well, seriously. But for the moms that are listening, that want to make sure that this doesn't happen to their kids, that is even more important, I feel, because why get to the point where you need to even have surgery? Why get to the point where you're Jon Levine and you can't breathe and you have tape, and your big Jewish nose is not working? Get to the point where you're going in to a doctor like yourself, who understands, how this works, and so they can breathe. But why? I always ask this to people who do things differently and in my mind the right way. Why aren't there more people like you that look at it holistically, that talk about sleep and nutrition and lifestyle?
Well,
where are guys like you? Can I clone you and move you into each state, so we can?
There's the bottom line, and there's not the money in prevention, and so physicians and dentists are paid to do procedures. I mean, the world of cardiology is oriented such a disease model. I get paid for catheterization, stents, angioplasties, and bypass surgery. Where do I get paid to sit with you for an hour once a week to coach you about nutrition, exercise, sleep? and stress. And
You get paid in spades. You know why you get paid in spades? Because you do eventually you do get paid. Maybe you spend more time, you don't get paid as much, but you're doing the right thing.
Oh, I'm with you.
You're doing.
I just think that's why people aren't involved. I think our systems, from the moment we're educating dentists and physicians, we're educating them to treat disease.
Well, that's the thing. I mean, what are we trying to do here? I mean, we're trying to help each other. So do we want to help each other stay sick? And that you're absolutely right. That's the way the system is. You're designed not to be cured. It's designed to stay sick and keep you on medication. But once you realize that, once you realize that that's the system, that doesn't feel good. You don't want people to stay sick. You want people to heal and get better. And there's a way to make money and do it the way you're doing it. And that's the thing. That's why I started this. We need to inspire other practitioners, not just people who are listening, because I do want moms to understand this. It's important. I do want kids to not have this issue. But there's other practitioners. We need more practitioners to say, you know what? I'm done with this. I can do things the right way. I'm gonna sleep at night better because I'm doing the right thing by my patients, which I can tell you do because you have the passion and you care that they're actually getting better.
Well, that's why I went to England. I couldn't stand if I was treating somebody wrong. Then
Yeah.
I needed to know that, and that's the last time I used headgear that would hold the maxilla back. But getting back to what is actually orthotropics, so moms and dads could understand. First of all, you got to intervene early. You need to see kids by age 6, particularly now, because a lot of 6-year-olds are dentally already age 8. Meaning where they used to have all their adult teeth by around 11 or 12, I've got 8 and 9-year-olds that already have all their adult teeth. By the time they have all their adult teeth, it's too late for orthotropics. So I need to see kids earlier, or any dentist involved with orthotropics. So I really want to see them earlier. Give me them at 2 years old, 3 years old, so I can start to coach the mom and dad about getting their lips together, stopping with bottles and sippy cups, and having them chew with their lips together, and helping them to understand why nasal breathing is important. And then as they get a little older, 4 and 5, they're used to me. We're developing a relationship, and now they may be ready for us to do some expansion and create more space for their tongue.
It's amazing. So you're telling me that it's really you have to breathe correctly, the way we're really meant to breathe, and your posture should be correct in order for your teeth to be at age 6. At age 6, instead of I'm 6 years old and at 8 years old, you should.
Well, I'm saying that might be. What I am saying is that kids are developing faster, and I don't know if it's because of what's in our foods or whatever, but if I said to you, hey, John, I need to see kids before age 8,
right.
For many kids at 8, they're too late for orthotropics because they're already like a 10 or 11-year-old dentally.
Right.
So I want to see kids at age 3 and 4. Because I can already start to influence moms and dads about posture and educate them.
Right.
And then if at age 6 they're ready and they need and would benefit from orthotropics, we haven't missed the window of time. So if I got up here and said, as long as you get there before age 8 and moms and dads take their child at age 8, it already could be too late to do orthotropics. And now we have no solution but potentially surgery down the line for some of these kids. And it's a lot of kids. It's gut-wrenching. I want to say one other thing about orthotropics. When John Mew taught me this, he said the key is the right child at the right age with the right parents. So we just talked about the right age. 8 can be too late. The right parent, the reason why orthotropics isn't popular, first of all, most dentists don't know about it. But the second thing is I'm putting my success in the hands of a 7 or 8-year-old or 6-year-old child.
Right.
Because I'm making an appliance, that training appliance, where they bring their jaw forward. Because after all, in the first phase, we've taken their upper teeth, and we've brought them way forward and up, and we've expanded their palate. And this enables us to widen the lower massively and bring it sometimes as much as 15 millimeters forward. To do that, though, the kids are using their own muscles. They're posturing their jaw forward. We give them a position, but they're not locked into it. They could do this. But they keep their jaw forward with their own muscles, and their good posture, their tongue up, and then they're changing their growth to a more forward horizontal growth pattern. Well, that's not for every 8-year-old. I mean, a lot of 8-year-olds are going to lose the appliance the minute they go to school. I need a kid that's going to want to please me, want to please mom and dad, is going to be mindful. I sometimes kid myself. You
want mindful kids?
Yeah, give me your daughter. You know? And I wish I met Nessa, 2 years ago.
My daughter's a rule follower, but there's a lot of boys who aren't rule followers.
And that's one of the challenges with orthotropics. You can't treat those kids with it because behaviorally or maturity, they're not gonna be able to do it. And that's a challenge. It's just not the right thing for all kids. Now, you try to come up with what they can handle, but it's not going to massively get their lower jaw forward.
Yeah, I think it depends on the personality.
Yeah.
My daughter's more likely to do it. She's going to ask questions and she's going to do it, and I see her do it.
Yeah.
I mean, she sits up straight. She eats the right way. If she's doing it, she does her exercises.
Right.
My son, God bless him, I love him to death. Less likely to do it.
He's a different animal.
Yeah, he's a boy. He's hanging off the chair. He's just his tongue's out.
I understand it.
Yeah,
and I have been humbled by this. In other words, when I first started with orthotropics, I wanted to save the world, and I treated some of the wrong kids. It wasn't the wrong treatment. It was a kid that didn't have the ability or didn't have the parents on top of it to make it through. I've gotten a lot wiser in the last couple of years. I've gotten great kids with great parents, and these kids are just knocking it out of the park. And you'd like to think, well, it's me getting better. It's just me selecting the better kids. So I go back to the wisdom of John Mew. The right kid at the right age with the right parent.
Right.
You give me one of those, and orthotropics is a great treatment strategy. But what I will say is, Mom, Dad, no extractions. There is no reason to extract teeth. When you're extracting teeth, you are potentially doing damage because we don't know when you take out teeth, you're going to pull the teeth back. You're going to make less tongue space and less airway. And what we don't know is how much do you have to restrict the airway and the tongue space before you've put somebody into an airway compromised situation.
There's never a need to pull a tooth.
Never a need to pull teeth. Man, you can expand out of dental crowding.
That's cool.
And you can take people who have already had teeth, adults who have already had bicuspids extracted, that are struggling with TMJ issues, that are struggling with airway issues, that are struggling with anxiety and depression, and you can reopen these extraction spaces by making these sagittal appliances which will reopen the spaces so that you can put teeth back in, create much more airway and tongue space.
You could put implants back in?
You can put implants back in. So people that have had 4 bicuspids extracted, we're now reopening those spaces, filling them with implants, but the point of the matter is we're giving them more tongue space.
Oh my God.
And we're getting them out of pain. It's called the extraction retraction regret syndrome, coined by Bill Hang.
So now we've taken the teeth out. We realized we made the mistake, and now we're putting the teeth back in.
Yeah.
Oh yeah, baby.
Crazy.
Oh yeah, God. I tell you what. Oh yeah, boy.
Yeah. You said
Be careful what you wish for. You just might get it. Sometimes less is more. And I do understand the world we live in with smartphones and all these things, and even me, I sit down and I'm looking at the phone. Now that I have the podcast, I have to be involved with social media, and my head's lower, and my posture's not the way it needs to be. Right. Obviously, 100 years ago, a lot of those things aren't the issues.
Right.
Then again, if there was, no antibiotics and a lot of other things, which we didn't have back then, so there's always a challenge.
Yeah, we're in a situation where we're adapting to the environment, and the adaptation comes at a cost. And how much, how great that cost is dementia and Alzheimer's, that's a pretty significant cost. And
Yeah.
so if you can't breathe correctly or cardiovascular disease, I mean, heart attack and stroke have been the number 1 and 3 killers in America since 1900, except for 1 year when there was a flu pandemic. We are doing more to save people, and yet it's still the number 1 and 3 killer because we're doing a terrible job at prevention, and there's so much more we can do.
And you just brought me to the Bale Doneen method. So the Bale Doneen method, which is something you sent me an email, and it was great. You're like, John, this is what I want to talk about. One, we should talk about early treatment for orthodontics and orthotropics, and number 2, Bale Doneen. So let's not forget about this.
Yeah.
All right, what is Bale Doneen method?
And hopefully we'll all see the relationship. So the Bale Doneen method is a method for the prevention of heart attack, stroke, and diabetes. It was developed by Dr. Brad Bale, who's still living well and teaching this method to physicians and, oddly enough, dentists, a few of us. And Amy Doneen is a doctor, nurse practitioner out in Washington. And she and Brad are teaching this method, and they wrote a book called Beat the Heart Attack Gene.
And they're not dentists.
They're physicians that clearly understand. In fact, they published a paper last year that showed the mechanism by which dental disease causes heart attack and stroke. And that's a really important word. Prior to that, there were many papers that indicated an association between gum disease and the incidence of heart attack or stroke. But they bumped it up, and they published a paper in a significant journal that said, hey, actually dental disease causes heart attack, causes stroke. That got my attention, and so I see my role big time now. I want to understand what a person's cardiovascular status is, and you realize nowadays with the doc in the box situation, people who used to have relationships with the physicians, that's not as much the case anymore. Usually a lot of people go into urgent care.
Sure.
But a lot of people still have relationships with their dentist, and they see them twice a year many times. And if dentists were doing a better job screening for cardiovascular health, we could absolutely take heart attack and stroke off the list as the 1 and 3 killers.
Well, maybe we'll start with bedside manner. And if you have a good bedside manner like you would make me want to come to you. And if you really cared about me and you asked about me and I knew that you were sincere and I knew that you really cared about my kids, which I now know, it's going to make me want to see you. Not only you, Dr. Avis, but other practitioners. So that it starts with and if you want to know for your daughter what she's going to learn at IIN, and I truly believe this, it's the primary nutrition.
Love that.
Your primary nutrition is going to drive the secondary nutrition. Secondary nutrition being the sleep, the actual food, the exercise. You treat me well, you have a good relationship, I'm going to eat better. I'm going to sleep better. You know, if you're pissed off, you don't sleep well. You don't eat well. Maybe you overexercise. Maybe you don't exercise at all. It just doesn't go in the right direction. So if you're sincere, authentic, passionate, and loving and caring like yourself, it starts there. It starts there. And even this sounds kind of silly, but like I coach my kids' rec sports because I love to be involved with my kids. And I love sports. So, and parents thank me, and they're like, oh, thank you for coaching the sports. And I'm like, oh my God, you have no idea. Like, I actually use it to run around with my flip-flops off because I'm grounding, and I'm earthing. Mm-hmm. And I'm getting exercise. I feel selfish about it. I'm getting exercise. I'm with my kids. I'm grounding. And it's the best thing in the world. But I care about the kids, and they know it. So things are getting better. It's that connection that you have to have between, you know when someone's going through the motions. When you go into a doctor's office, there's good and bad with everything. When you go into a doctor's office, you know if that doctor cares. He's looking at you. You know he's not rushed. He's spending the time, and he's asking certain things. He remembers You have 3 kids. He remembers your kids' names. He remembers certain things. That makes you feel damn good. It's got to start there. And then the rest will follow, in my mind. But then you take the flip side and you go into a doctor's office and they're 45 minutes late. 30 minutes, whatever. You've been in the waiting room. They don't respect your time. You get in there. They're looking at the chart. They don't even look at you. They don't barely remember you. And that you could just tell by their energy. Not that they have negative energy, but their anxiety levels. Their anxiety levels are through the roof, and you could tell that they're already thinking about the next patient. And then the next patient, and what they're doing for lunch, and what they're doing for dinner. They're not mindful, if you will. So you brought up mindfulness, and that you have to be mindful. You need mindful patients. You need mindful doctors who, when they're in the room with you, they're actually mentally in the room with you. Because a lot of them are not mentally in the room with you. And you know it. A patient knows it. And it goes wrong. It goes south immediately right there. So if you really want things to go well, you need to really want to care.
So inherently, I think most people are good and they want to do good things. But I think for the medical and dental world, which I know pretty well, they have to be really either so discouraged with the quality of their professional life or so inspired by a new vision, whether it be Bale Doneen or Orthotropics, to step out and say, I want to do something differently. So at a recent Bale Doneen conference, I was sitting with a physician, and he's a MD VIP. You familiar with that?
No, what is it?
It's an organization. MD VIP is an organization that helps physicians transition out of seeing 2,000 patients to having a patient roster, having more of a concierge practice.
Oh, that's great.
So
MD VIP.
Right. So they're now MD VIP doctors. They've signed up with
awesome.
this firm that helps them make the transition. So I said to the doctor, we were having lunch, I said, so he was there learning the Bale Doneen method. And I said, tell me about the MD VIP and that experience. He said, well, first of all, really helped me with the, just all the challenges of making that transition. And he said, I don't know that I'm making any more money, but he said, I'll tell you that 50% of the stress in my professional life has gone away because I'm now seeing about 400 patients. That's my active roster as opposed to 2,000. So I'm spending more time. So I said, what's your ability to do the Bale?
Less is more.
Yeah, so I said, what's your ability to do the Bale Doneen method? He says, I don't know how to incorporate it. Because to do the Bale Doneen method, when Kim and I became patients of Dr. Pritchard and Dr. Bale, and Dr. Pritchard, by the way, she now collaborates. She works in my office. She comes from Dallas, Texas, and spends 1 week every month in the Avis alternative dental practice doing the Bale Doneen method. So I refer family, friends to Dr. Pritchard so that they can avail themselves. So unlike Kim and I, where we went to Nashville, Tennessee to become patients, I've made it really available in this New York area.
Oh, that's great.
She's the only one doing it here.
And what's her name again?
Dr. Gina Pritchard.
Dr. Gina Pritchard.
Right. So she now teaches with Brad Bale and Amy Doneen, and she helps other physicians who want to implement it, how they go about doing it. But the point what I wanted to make is when we went out to Tennessee, of course my wife said, are you crazy? But we had already been to...
But is this Jeannie that my daughter's talking about?
No, this is another Gina.
Oh, that's Gina. Okay.
Gina.
Okay.
And so when we became patients, my wife lost her dad at 52, heart attack swimming in a pool.
Sorry. Oh.
And she was diagnosed, Kim, with high cholesterol, and we referred to a top New York hospital. And we went there for a cardiovascular workup. And I left there so uninspired and unimpressed. I was like, there has to be more. And I didn't know anything about cardiovascular disease at the time. And I just started asking questions, and a colleague said, hey, you got to read this book, Beat the Heart Attack Gene. If my brother-in-law would have met Dr. Bale, he would not have died. He died, and I just feel he didn't get the right prevention. So I devoured the book, I listened to the book, and then I made an appointment. And Dr. Bale, you still practicing? Yep, I can see you in 7 months. And at the time, Dr. Pritchard, I didn't know her then. She's the one who answered the phone. But we went out to Tennessee. We didn't know where we were going. We show up. It's obviously his house. But our appointment, and he had all our blood work, all our genetic testing, all our urine, everything. He spent from 8 in the morning till 4 in the afternoon. It was Dr. Pritchard, Dr. Bale, Kim, and I. That was the best medical experience I ever had, and they gave us we had disease, what was the cause of the disease, what we needed to do, and they gave us an action plan. We became ongoing patients of Dr. Pritchard after that, and soon after she started practicing alongside me. But the point of the matter is, even these concierge doctors at 300 to 400, they're really hard pressed to really practice even that level of medicine. But I got to tell you what, as a patient, very important story. Nobody was looking at me. My cholesterol's fine, my weight's fine, blood pressure's fine. But my mom died of heart disease. She had bypass when she was 65, which recognized she must have had heart disease for many years prior. And my dad just had triple bypass, even though he's 89. By the time he got, and a dear friend did the catheterization, he was so clogged that they couldn't be stented. He had to have triple bypass, and he's really struggled since then. So the point of the matter is, when we went out there, they did a CIMT, which is an ultrasound.
Okay.
That's not Doppler. Doppler looks at flow. And if the flow is interrupted, it means your carotid arteries are clogged and you have some serious problems. And it made me think back, because my mom, they said, hey, you're not yet 70% blocked, so you don't need anything now. And I think, God, was that insane? She was so diseased, but they had to wait until she was 70% blocked before they were going to do, a carotid procedure.
Right.
So I go out there and they do a CIMT, and I fall in a category of having a 40% risk of having a heart attack or stroke in the next 10 years.
You did?
Yes, I am. There's a study of over 10,000 people called the Café de Cave study, where they did CIMT. And if people had plaque in their artery wall, not in the lumen, but in the wall that was 1.3 millimeters or greater, 40% of those people went on to have a heart attack or stroke in the next 10 years.
Wow.
Underneath the Framingham risk score or the Reynolds risk score, which look at blood pressure, smoking history, weight, I had less than a 1% chance. The point of the matter is, I'm the one that everybody misses. Wasn't there a guy recently who's like on The Biggest Loser who had a heart attack because he has Lp(a)? It's a genetic marker for the wrong types of cholesterol.
Oh, wow.
Point of the matter, there's so much we could do to prevent it, and this CIMT is a beautiful, non-invasive, but few people. My daughter just got trained to be a CIMT ultrasound tech because we were having to fly people up from either Florida, Texas, or North Carolina to do them up here because there's nobody in the New York metropolitan area that's trained to do CIMT ultrasound.
I want to remember to say this as well.
Yeah.
If you don't, if you want to know what the before and after photos look like, I will put them up on YouTube. But when you're listening, look at before and after pictures for Orthotropics. Is there a particular website? Is there on your website?
Yeah, there's some on my website, and there's links to John Mew. Those are pictures from John Mew and Bill Hang. They both have some really, really nice pictures and graphics.
Is it avisalternative.com?
Avisdds.com.
Avisdds.com. There it is. Thank you, Ming. Avisdds.com. We are not done, but I just want people to understand that there are before and after pictures of. And
there's no orthodontics with braces in any of those cases. That's all done with removable orthotropic appliances, and all it's doing is creating loads of space, both horizontally and posteriorly, and training the kids to keep their jaw still and forward so they grow in a more horizontal pattern. That's what you're seeing.
Breathing correctly and creating space.
Yeah.
And the teeth will do what the teeth need to do.
Mm-hmm. And if you look at the top, I don't know if people are seeing it, but on the top left, lips are apart, next lips are together.
Yep.
And that's a common theme there.
We're looking at before and after pics, and they're dramatic.
Yeah.
They're very dramatic.
Yeah. And by the way, John Mew, because dentistry is socialized in England, he really objects that the citizens of England and the parents are not given an opportunity to understand that orthotropics is an option. He picketed outside the British Dental Association at the age of 89, and they took away his license, which is obviously a joke because he's kind of pretty much done practicing, but he wanted his day in court to present what the true cause of crowded teeth is, that it has nothing to do with genetics or your jaws being too small for the big size of your teeth,
Right.
and that it's a significant health issue. And so he purposely had a one-man picket so he'd have his day in court. But that's how strong associations are coming out against dentists that are even thinking about practicing orthotropics.
Well, I'll tell you what. If you empower parents, especially moms, and you get them on board, oh baby. My wife is a mom, and she's a mom who, I mean, moms just, they care. You get a mom that she will fight for her kids. You give her the information, which we're giving her, and you empower her. Oh, you don't mess with moms like that. They will go to the end of the earth for their kids. That's what we're doing here.
Yeah.
And when if they want orthotropics, if they want this method, if they want the Bale Doneen method, and they want this, things will change. Things will change when they're going into the office and they're saying, this is not acceptable. I have another dentist that I use he doesn't use fluoride and mercury. If you go to the dentist and you say, I don't want that. I don't want the mercury in my teeth. I want it out. I don't want fluoride. You get enough of those patients, you're not going to have a practice anymore. You're going to have to change. So it starts with empowering the moms and having them understand this. My wife is one of them.
Yeah, I mean, somehow she went on her own search, because she was referred to me, I think, by John and Michael Mew. So she somehow called England. So I don't even know where her journey started, but somehow she figured out there were some issues that might not be being addressed.
Wife.
Yeah, wife.
Yeah, I'll tell you the story. Well, one, she's got an open mind. Mm-hmm. She's willing to look at things holistically, and she's just got an open mind. Some people are just closed off, and they're like, I know everything, we're all good to go. But if you have an open mind, I mean, I think that's the start. And then we have friends in Poland. My wife's Polish, and we were in, actually, Portugal. And my friend's sister is a dentist, and she's also pretty blunt. And she said, Yashu, which is Polish, and Anya, she's like, your kids have breathing issues, and they need orthotropics.
Wow.
She was as blunt could be. And then she said to Anya, she's like, you have to read these books, Jaws. She's like, I'm going to send you this book, Jaws, and you need to read it. And we did. And I didn't read it, actually. Mm-hmm. Anya read it. And that started it.
Gotcha.
So then it was, where am I going to find someone in the area that does orthotropics? And then she did her search, and you came up. And the rest is history.
Isn't that amazing?
So everything is meant to happen for a reason, I guess.
So it came from a friend in Poland.
Poland to Portugal to New Jersey to Staten Island, back to New Jersey to the Hol-Truth Podcast with Jon Levine, with Dr. Avis. And isn't that funny how that works?
And it is amazing. The number of referrals I've gotten from John and Michael Mew from people calling to England is just, never would have thought it's happened. But it's, once people read it and it makes sense, and they look at their struggles with their own children, you'll go wherever.
Yeah, look, some things, sometimes if you have an open mind, you're just willing to listen. If you're just willing to listen, maybe you'll learn some things. And maybe you disagree. Who knows? Maybe Anya would have, read the book and said, this is a bunch of crap, and she, didn't like it. All right, it's fine. You don't like it, you don't like it. But if you don't try, you'll never know. So I think having the open mind is...
The first child that I treated with orthotropics, she was one of the kids that was in headgear. That's where you have this thing that you wrap around the back of your head and it's holding your jaw back.
Yeah, when were they ever using that?
They're still using it.
Headgear?
Headgear, big time. Yeah, because that's how you treat buck teeth in traditional ortho, is you try to hold the maxilla, the upper jaw, back and hope that the lower jaw catches up. It's being done all the time, all over.
Wow.
Because if you're not successful with headgear, then you have to pull out the upper two bicuspids and pull the teeth back. Of course, you imagine what happens to people's faces. Their nose bends and their upper and lower jaw back, so they have concave faces. It ruins faces, but you get straight teeth.
Damn that doctor for giving me the headgear. You see what happened to me?
So when I was, you didn't have headgear, did you?
No.
Okay.
Not that I recall.
Like it.
And if I did have headgear, I would put it in my subconscious.
And I'm checking
and tell you that I never had it.
You at least have 2 bicuspids. That's
Do I?
good on either side, yeah.
Yeah.
But so anyway, when I was doing that, I was told by a mentor I was working with in traditional ortho that if Olivia wasn't great with the headgear, that we were going to have to extract the upper bicuspids, and that's the one I couldn't get out of my mind. Well, not only did we not extract, we switched her into orthotropics. She had more room for all her teeth. Her face is flat out beautiful, kind of like the pictures you saw before.
Yeah.
And that family is so pleased with what we did, and that was actually a 5th generation family. Because when I had to go to her and say, hey, Mom and Olivia, you're going to think I'm crazy, but I want to change gears. I want to get you out of this headgear, and I want to do something called orthotropics, and you're going to be my first patient. What do you think? You think there had to be a lot of trust there? But boy, that case, just made a believer in me, and what a difference I've made in Olivia's, I think, health and well-being.
That's great.
Her face is beautiful, and her teeth are straight, and it's amazing.
And you got to start somewhere.
Yep, you got to start. So you just...
Someone's got to be the first.
When you know something is wrong and you can't sleep with it, you just gotta at least give people the option and explain it. So that's what we try to do. At least help people know about it.
Yeah, you know what? The information doesn't mean you have to do anything. No one's forcing you to do anything. We're just giving you the information so that you're informed and so you can have the option.
Right.
And just know about it. And then obviously empower and inspire people to kind of go out and do it. For dental health, other than brushing your teeth, flossing your teeth, I mean, maybe a tongue scraper, what else could you possibly do? So what I'm getting...
I'm glad you're asking that question.
This is what I'm getting at.
Yeah.
What I'm getting at is the pathogens in your mouth, right? So the mouth is a very dirty place. And I guess the pathogens create the cardiovascular disease.
Right.
So what we're saying, I guess, essentially is it really starts in your mouth and then spreads throughout your body. But to back up again, other than the typical, we all know we need to brush our teeth and floss our teeth, was there anything else we could do? I do oil pulling, by the way. What do you think about oil pulling?
I'm okay with it. I mean, it's a real significant commitment and effort to do it. It doesn't taste particularly great. I don't see a harm in it, but by and large, it's hard to get people to brush twice and floss and use a soft pick and brush their tongue, much less do oil pulling. So for the ones that come to me and say, hey, Vic, I'm doing oil pulling, what do you think about it? As long as they're doing the other things along with it, right, I'm fine with it. If they're going to not use their toothbrush and just do oil pulling, I'm not thinking it's such a proven strategy.
Do you brush your teeth the first thing in the morning? What I'm saying, not you, but like, should you brush your teeth? Like, hopefully I'm doing this correctly. I wake up, I brush my teeth immediately. It's the first thing I do. I brush my teeth immediately. I brush my tongue, and I get all the goop out of my nose, and I drink lemon water, and it's the first thing I do. I don't eat first. I just brush my teeth. Is that the right thing to do?
I think the key is if somebody wanted to have breakfast and then brush after breakfast, it's not a problem. The key is you want to basically get the plaque off your teeth and any debris that's between your teeth off and not leave it sitting there. And you want to at least try to do that every morning and every night at the minimum. And so you've got to use something to get all surfaces of the teeth. So a toothbrush is not going to get in between teeth. So you need to use either a dental floss effectively, a water pick or hydroflosser, or we're really excited about these things called soft picks.
What about your wife's thong? Would your wife's thong work for trying to get?
If you have a big enough space between your 2 front teeth, that would actually be the right instrument for the job.
Potentially, right? We're venturing into uncharted territory here. For
yeah,
you don't teach that at your practice?
I have not seen that, but it's a very good thought, John.
You never know. But if I brush my teeth the night right before I go to bed and floss my teeth, which I do, and then I wake up in the morning, there's nothing in my mouth. So, meaning there's no food in my mouth, there's nothing. But isn't there from sleeping throughout the night? Isn't there bacteria that builds up in my mouth? So my thought process has always been, and maybe I'm wrong, that even though there's no food in my mouth, I've brushed my teeth, the 7 to 8 hours that I sleep, I wake up and then there's the bacteria, the pathogens are now in my mouth again. And my idea is to get them out before I even eat, because if I eat, I'm kind of swallowing the bad bacteria. I don't know if that's accurate or not.
I have never heard that thought. I mean, here's you know what a Petri dish is? You remember that from middle school?
Yeah.
So you put in this culture and you can grow bacteria on it.
Yeah.
So your mouth is a hell of a Petri dish, or it's a puddle full of organisms. So at nighttime, these organisms are multiplying and developing. Now, there's some good ones and some bad ones.
Right.
So if your pH of your mouth is more acidic, you're going to develop an imbalance of more of the bad ones. If you're more neutral, you're going to get a better balance. So the key is, in the morning, what you're trying to disturb this buildup of the bad bugs, which are anaerobic bacteria. So I don't think it makes a difference whether you're going to create an influx of this bacteria into your bloodstream, whether you brush before breakfast or after breakfast. But if you are keeping the balance better, more of the good bugs and the bad bugs, that's the whole name of the game. Now,
Gotcha.
the other thing I want to mention, because you touched on it, there's a whole new development in salivary diagnostics, where we take a swab, we swab the tongue, we swab around the inside of the lower teeth and the upper teeth, and we send it away to be cultured to see what types of bugs are in your mouth.
Oh, wow.
And we're particularly looking at 9 different types.
A lot of bugs.
Well, the key is that 5 are significant for cardiovascular disease as well as gum disease.
Okay.
And then you could also run one for your host inflammatory response, interleukin-6. And so we can look at the saliva and get a lot of information about the types of bugs in your mouth. But here's the simple thing is that, number one, I love people to get these little soft picks. I don't get any money from the company. I think it's made by GUM, the gum
Those are the
company,
ones that go
in between.
Right.
Right, and they're soft. So if you rubbed it on the inside of your cheek or the inside of your lip, you're not going to create bleeding.
Right.
But you're supposed to take that pick and you go between every tooth, and you should have 0 bleeding. If it bleeds, it's not because you're brushing too hard. We purposely want you to not only be brushing the sides of the teeth, but you're actually massaging the inside of the gum tissue between your teeth.
Gotcha.
When there's inflammation, it's going to bleed. When it's healthy, it's not going to bleed. So step 1 is you should have no bleeding with your toothbrush, your dental floss, and your soft picks. And when you come to our office, the first thing my hygienist does at every visit after talking about you and getting any change in your medical history and taking your blood pressure is she takes that soft pick and we get a papillary bleeding score. We want to know how many spots in the mouth bled when we went in with that soft pick, and there's no goal but 0. Anything but 0 is not healthy. If your hand was bleeding and you're sitting here and you're bleeding from your hand, hey, John, you're bleeding from your hand. Oh, I got another hand. That one's not bleeding. But that finger is pouring out blood. I got 9 other ones, Vic. What are you worrying about? Why in our mouth we got, 28 different areas, and you say, I'm only bleeding in 5. Are you kidding me? You are throwing so much bacteria into your bloodstream when you have that kind of inflammation. It's crazy. And then if I do a salivary diagnostic and you show up with these bacteria that are complicit with the causing of heart attack and stroke, I'm a little worried, man. You've got bleeding gums and you've got the wrong types of bugs and they're going in. So first of all, I want you to have no bleeding. Once you have no bleeding, then let's retest and see if you have the wrong types of bugs. If you have the wrong types of bugs and you have some significant red flags, or we already have done a CIMT and we know you have cardiovascular disease, you have atherosclerosis, then we're going to chase that that look under a microscope at what types of bugs with either mouth rinse protocols or a perioprotect tray that has a hydrogen peroxide gel. We're going to go after and try to change the flora in your mouth.
Fluoride or no fluoride?
I'm letting my parents choose. I just want them to know the benefit. So if a kid comes in and they have had they have decay, and the mom's against fluoride, I say, listen, you can't have it always. If your child is eating processed foods and junk and carbohydrates and candy, and you don't want to have fluoride, you're going to have a disaster here. if you're eating healthfully and you're brushing well, I think fluoride is not even important. So it's the wrong question. It's more about lifestyle. If the nutrition is good and the habits are good, you could brush with water and I think you're fine. But if you're throwing sugar in your mouth and you're not brushing it off well, then you better try to use every Band-Aid you can. Sealants, fluoride tray. You know what I mean? It's really a silly question. It's a good question, but the problem is we're trying to compensate for poor lifestyle choices.
Right.
So I just want the parents to choose, okay, if you're going to go anti-fluoride, you better up the lifestyle and the home care with your child. Don't do both. No fluoride, poor home care, poor nutrition. That's why, Timmy here's got 8 cavities and he's 5 years old now and he used to go to the OR and have general sedation to fix his teeth. This is not a good strategy.
I hear you. Pros and cons of dental implants.
Yeah.
Pros and cons of dental implants. This is something this is part of your email.
Yeah.
You said to me, and I looked into it. So
I've been involved with dental implants my whole career. My dad was really a pioneer. He was doing dental implants in his career. And when I graduated from Georgetown University in dental school in 1987, it's when they honored Pierre Branimark, who was kind of the original of the modern era of implants. So in 87 is kind of when implantology was born in America. But the truth of the matter is implants go way, way, way back. I mean, you can find implants in hundreds of years ago, so it's not new. But it's a phenomenal development because one of the magics of implant is what you don't have to do to teeth on either side. So in the old days, if somebody was missing a tooth, you would cut down the teeth.
I got to cut you off for a second. If you don't take the damn teeth out in the first place,
you we
won't need these dental implants.
Exactly.
So I had to ask you the question.
Yeah.
Because you wanted to talk about it, and I want to talk about it. And listen, people have taken their teeth out, right? So people still take their teeth out, and we're making some mistakes. But our whole conversation this whole time has been what?
Prevention.
Let's not get to the damn point where you need the implants. But if you do need them.
Let's say somebody knocks a tooth out in an accident.
There you go.
There you go. So if you knock that front tooth out,
don't piss your wife off, and don't floss with her. Don't floss with her undies, with her thong.
Don't play sports.
And you won't lose your teeth.
So you knock out that front tooth and a basketball elbow to the face.
That's true.
In the old days, you'd have to cut down the teeth, perfectly healthy teeth on either side, to make a bridge. Now you got about an 8% chance that those teeth on either side are going to need root canal. So times 2, you got a 16% chance. Now, ultimately, those margins can leak, and now you get decay under it. So now you need another bridge, and now the tooth that has decay fails, and so now the tooth, instead of 3 teeth being involved, it's 4 teeth, and then more root canals and more fractures and more implants. So the point of the matter is, the beauty of implants now is if you get that front tooth knocked out, you don't have to touch the teeth on either side. You could put an implant in a single crown. Less is more. Implants are preventing you from doing unnecessary dentistry to teeth on either side of missing spaces. That's one of its magics. And the other thing, it preserves bone. When you lose a tooth, if you don't put an implant in, you get resorption, disuse atrophy, and the bone shrinks. It shrinks vertically, it shrinks horizontally, you get a significant defect in the bone. When you put an implant in, you preserve structure, you preserve bone. So it has a lot of benefits, and the science continually grows and improves.
What are these implants made of?
Titanium alloy metal. They're all made of titanium alloy metal. They have certainly over the years experimented with different types of material, but by and large, I'd have to believe that 99%, if not more, titanium alloy that are going in now, and they have really proven themselves to be successful. It's the same what they're using with prosthetic joints. It is titanium alloy. It's very biocompatible.
It's a good point you brought up. I was saying, obviously don't pull your teeth, but you're right. I mean, if you play sports and you have your tooth knocked out, to be fair,
Right, or have the people that
or
are
punched,
or
by your
people that
wife.
are in dentures, and they're really crippled by dentures. They can't eat what they want. It changes the taste of food. And when you can take somebody from a denture and give them teeth that are no longer removable, and you're no longer covering up their roof of their mouth, and they no longer have acrylic in their mouth that's absorbing different, it's porous. It's a life changer. And so some people as kids didn't have the opportunity to have good exposure to good dentistry, and they lost teeth, and now all of a sudden they're in a different category of life. And they want an opportunity to have something that's like teeth again. Implants can do it. So it really can help people in a significant way. One of my staff lost her teeth as a young teenager in a car accident, and she was in a dent. She said she woke up and all her teeth had been taken out and given dentures, and I think she was 13 or 14 years old.
Oh, wow.
And finally, when in her early 50s, her whole upper arch is now implant supported. She no longer wears a denture. What a difference for her.
That's good. Well, you're making a difference. I want to wrap this up.
Yep.
But if people want to come see you, you're located in Staten Island. What's the address? The almost 100 years at this location.
Yeah.
What's the address again?
15 St. Paul's Avenue. And in New York, parking is a big thing. So we have our own parking lot, and you don't have to pay, and it's very easy. And it's the office was years ago a home, and we try to make it feel like when you come into our house, like you're our guests, and our reception area, looks like a living room. And we want people to. They're like our patients, really become our family, and we want to take care of you and your family like you're part of our family.
Well, you've done that for my kids, and I thank you for that. It's also avisdds.com, avisdds.com, and go see him, call him. That was great. Thank you for coming
Thanks,
on the
John.
show. It's been an honor and a pleasure. Nice to finally meet you.
Yeah, really nice.
All right.
I enjoyed it. Thanks so much.
That's a wrap.
All
Till
right.
next time. Adios.